Hello and welcome back to GP Video Podcast by Nadia. So as you guys know that we have been talking about dizziness, and we have already established that dizziness has 4 causes or can be categorized into 4 different categories, and then those categories have different causes. So number 1 was vertigo, which means either the person has the sensation of the body spinning or the environment spinning. Then number 2 was disequilibrium. Number 3 was lightheadedness, and number 4 was pre-syncope. So pre-syncope is the fainting, the sensation that you are going to faint. Then you have lightheadedness when you get just disconnected from the environment, and then you have got disequilibrium where it's a gait disorder and you cannot maintain that. So let's start talking about vertigo a bit. I would again like to tell you that dizziness is a common and very distressing presentation in general practice and accounts for about 5% of the presentations to general practice. In more than half of these cases, the dizziness is due to vertigo. So out of these 4 categories, the one that we have very important, or half, like 50% of the times, the one cause is vertigo, which is the illusion of movement of the body or its surroundings. It can have central or peripheral causes, and determining the cause can be difficult. Okay, so now when we talk about the different causes, as I said, that it's either the ears or the brain. Okay, so let's have a look at it. As to, there is a chart that I would like. Yes, so this is the chart. So most common differential diagnosis of vertigo, number 1 is labyrinthitis, vestibular neuronitis, benign paroxysmal positional vertigo, and Meniere's disease. So these are all the 4 most important causes of peripheral vertigo. We'll talk about central vertigo and the causes of central vertigo some other day, but for now, the peripheral causes are benign paroxysmal positional vertigo, Meniere's disease, vestibular neuronitis, and labyrinthitis. Okay, so again, if I want to go, so labyrinthitis, the inner ear is composed of the body and the membranous labyrinth. Acute labyrinthitis is inflammation of this labyrinth. It presents with vertigo and hearing loss preceded by a viral infection. So what is labyrinthitis? Labyrinthitis is basically the infection of the inner ear, and it presents with vertigo and hearing loss, and so it's preceded by, or usually there is a viral infection of the ears, and then that happens, or a general viral infection, and then that happens. Okay, so in labyrinthitis, onset and duration of vertigo is few seconds to minutes. What is the provoking factor? The provoking factor is change in the head position. Special features: tinnitus, ringing in the ears, and hearing loss is present on the physical examination. So we spoke about dizziness, which is a very common presentation. Dizziness can be classified into 4 categories: vertigo, then we have disequilibrium, then we have pre-syncope, and then we have lightheadedness. 4 causes of, or 4 classifications of dizziness. Vertigo is the 50% of presentations of dizziness. Now, vertigo can again be classified into 2 causes: central causes, brain causes, and peripheral causes or ear-related causes. So what are the most common differential diagnoses of ear-related causes? They are labyrinthitis, vestibular neuronitis, benign paroxysmal positional vertigo, and Meniere's disease. So the one that we have spoken about today is called labyrinthitis, which is the infection of the inner ear, and it is usually accompanied with vertigo and hearing loss, and it is usually preceded by a viral infection. So onset and duration is few seconds to minutes. Provoking factor is change in the head position. It is also accompanied with tinnitus, which is ringing in the ear, and on physical examination, hearing loss is present. We'll talk about vestibular neuronitis, BPPV, which is benign paroxysmal positional vertigo, and Meniere's disease next time.